Welcome to Your Health. I'm your host, Rhonda Alfred, and on this episode, I'm joined by Dr. Caleb Dupre, a hospital medicine physician, and Kirby LeCompte, physician practice administrator. Terrebonne General has opened a multi-specialty clinic in Gray, and they're here to tell us more about the clinic and what it has to offer. Welcome to the show.
Thanks for having us, Rhonda.
All right, well, let's get started talking about this new clinic and where it's located. Kirby, can you tell us a little bit more about the multi-specialty clinic and what's going to be offered at the clinic?
Yeah, Rhonda. So we were extremely excited when Terrebonne General let us know that we were looking into opening a multi-specialty clinic in another location. We don't have much in Gray at this time, so when it was told to us that we were opening this, we were all on it. So in the multi-specialty clinic, we currently have an internal medicine provider that is there Monday through Friday, along with some specialties such as pulmonology and endocrinology, and eventually we would love to open it up to other specialties.
Okay, great. And where is it located, Kirby?
The Gray Clinic is located at 115 Eureka Drive, which is across the street from HL Bourgeois.
Okay, very good location there. And why did you decide to open this satellite clinic?
So the satellite clinic was opened to be able to offer access of care to patients in all locations. Like I mentioned in previous segments, our mobile clinics are there for our Bayou regions, and we also have Terrebonne General in Houma, and then our multi-specialty clinic in Gray will offer services to our Morgan City area, along with our Gray, Schriever, and other surrounding areas.
Okay, so you can reach all the different segments of our community.
Correct.
Dr. Dupre, let's bring you in. Tell us a little bit more about the primary care or internal medicine type care that you're providing there.
Sure. Currently, Terrebonne General is staffing internal medicines physicians there. We provide internal medicine doctors are kind of like the quarterback of the healthcare system. We are able to manage multiple aspects of someone's health, whether it be acute illness or chronic illnesses. There's a lot of things. We're kind of like the jack of all trades in a way. If there's something that we can't provide for you, we certainly can get you to a subspecialist that can help us out. And so that's kind of our way to help prevent and both manage chronic illnesses.
Okay, something that is very much needed, especially in our community. Tell us more about the specialty care that's going to be offered at the clinic.
Sure. Currently, right now, we have endocrinology, which is the study of glands and hormones in your body, managing both deficiencies and in excess. And so if you have a problem with your thyroid or your adrenal glands, they can certainly help with that. They manage anything from complex adrenal diseases to diabetes even, and so those are all services that they can provide. We also have pulmonology who's available, and so any complex lung infections or chronic lung diseases, from interstitial lung disease to asthma, they can treat it all. So.
Okay, and are you accepting new patients at the clinic?
Yes, ma'am, we currently are accepting new patients. Internal medicine does require the subspecialty services like endocrinology and pulmonology require a referral, but internal medicine doesn't.
Okay, great. And what about, do patients need an appointment or can you just walk in?
So we prefer appointments, but we know that there is a need for people that need providers or to see specialists, so we do accept walk-ins. But like I mentioned before, appointments are preferred.
Okay, and what are the hours of the clinic?
The hours of the clinic are Monday through Thursday, 8 a.m. to 4:30 p.m. and on Fridays we're there half a day from 8 to 12.
Okay, and Dr. Dupre, can you tell us a little bit more about managing chronic diseases and how important it is for a patient to see their doctor?
Especially given these times where a lot of clinics have been shut down due to the storm. If you can intervene early enough, one, prevent disease, or two, you can stop people from needing to be hospitalized inpatient. And currently a lot of hospitals are down. It might be a year before some of them are back up and running in our areas. So that having access to primary care services is even more important now than ever in our community.
Right, very much true. And Kirby, tell us that number one more time, where to reach out to call for an appointment.
To make an appointment, you can contact us at 873-4729, and that's 873-GRAY, G-R-A-Y.
Okay, thank you. Anything else you'd like to add?
Go Good. We are excited to be here and to be able to work for Terrebonne General and all the initiatives that they bring to the community.
All right, well, we're looking forward to seeing you all at the clinic. Thank you
Thank
so
you.
much for being here today.
It's a pleasure.
Terrebonne General is doing everything possible to reach all segments of our community. They're growing and expanding to offer care through their multi-specialty clinic. For more information, visit tghealthsystem.com. I'm your host, Rhonda Alfred, and thank you for joining us on To Your Health. I'll see you right back here next time.
There are many strengths in our cancer center. I think one of the biggest is patients don't have to go elsewhere to get technology for their diagnosis and treatment of their cancer. Our treatment machine, the linear accelerator, allows us to pinpoint and treat cancers with more accuracy than ever was possible before. Mary Bird Perkins Cancer Center provides leading-edge technology with the highest quality care and the best treatment options unique to each patient.